Welcome to A Healthy Dose of Humor, a podcast series that sets out to explore the intersection of humor and health. I've partnered with Leith, a creative agency with specialisms in advertising, communications, and health, to bring together patients, healthcare professionals, scientists, and advertising experts to debate and discuss all the ways that humor can help us communicate. So let's get stuck in. In this episode, we're going to take a look at how different levels of trust allow us to be more humorous. Joining me today is Emma-Louise Fusari, a nurse with over 20 years of experience. Emma left the NHS to start her own health tech company, In-House Health, which works with SMEs and leaders using a clinically led and data-informed approach to establish and eliminate the root cause of work-related ill health. She was named Innovator of the Year at Computing's Women in Tech Excellence Awards for her pioneering health tech work. Also joining me is Sarah Welsh, co-founder of HANX. Dr. Sarah Welsh is an accomplished medical doctor specializing in gynecology, obstetrics, and sexual health. She left the NHS to co-found HANX, a sexual and intimate wellness brand that was built with real bodies in mind. HANX uses humor and straight-talking language to break down barriers when it comes to taboos in women's health. Sarah has also taught as an honorary clinical lecturer at Imperial College, as well as leading sex and relationships education in UK schools. And finally, I'm joined by Vic Milne, head of strategy at Leith, and who is very proud to manage a team of brilliant people with capabilities ranging from traditional brand planning to digital ecosystem modeling. In her 27 years in the industry, she has worked across a multitude of campaigns that range from selling whiskey and fizzy pop to behavior change to improve health outcomes. The irony of which is not lost on either of us. Hello, Vic. Thank you all so much for joining me. I think the big question to start with is the importance of trust and how humor can help, especially from a healthcare provider perspective. Emma, tell me, how important is trust in establishing that nurse-patient relationship in terms of strengthening it? Tell me more.
I think it's really important. I think as a nurse, a lot of the time you are the front line when you get to see patients. Nurses have an image that we are kind of, the go-to person when people want kindness and compassion. And I think humour is really important in establishing that trust, honesty, and being able to deliver really good messages to patients when we want them to buy into the advice and recommendations we're giving them.
Do you consciously use humor, therefore, to help with that?
I mean, consciously is a bit of a strong word. We don't have like a clown mask in the drawer just to put on when someone walks in the door. I think humour is really dependent on the individual and the healthcare professional, and part of their own personality and how they deliver humour to patients is very different. But I think for me, it's something that I've kind of integrated into the way I work with people. I don't know if it's to do with my own kind of background and socioeconomic class, etc. But, it's just kind of the way I've always worked. I like to think I'm funny, but, other people will say differently. But that tends to, as a patient, that relieves my anxieties and fears. And I try and use that with my patients as well.
That's brilliant. As a comedian, I know that if I get a certain job in the audience, if I'm hosting a show, I might use a similar joke, on that individual as I did maybe the week before when I found that job in another club. Do you find the same thing? Do you use similar jokes or similar tricks in similar situations?
So for example, so I'm from a general practice background, and smear taking was one of my roles, and people were always like, oh, how can you do that? And actually I used to enjoy it because I could make ladies feel comfortable and use humour through that. So for example, it's always that question of where to put my bag, where to put my knickers, like, oh, here's your dignity paper that's like this, very small size piece of blue paper roll to cover all your bits, lie on the table. And I used to say, leave your socks on. And then when I'd get to the bed, I'd always talk about someone's socks, whether they were odd socks or brightly coloured ones. And that would just help that lady relax into it, and it would be a much smoother and more comfortable process for them just by breaking down the fear and anxiety around that particular kind of thing. But yeah.
Do you know what that is brilliant? Because I'm even picturing it myself, lying on the table and knowing that you're looking at my socks. Because if I didn't have my socks on, you might be like commenting on my labia or something. You know, it's not quite the same icebreaker, is it?
Fungal toe infection.
Right, exactly. No, that's a really clever trick. Not because it's not just about you as a nurse and your relationship with the patient. It can also be your relationship as a nurse to the greater healthcare industry. Have you found that there are organizations using humor with you to communicate?
It's not really something that jumps front of mind for me. I think humor is used a lot in peer-to-peer communication. So, you know, you should hear what people talk about in the staff room, for example, and people are like, oh, does that not put you off your lunch? Definitely not. Nothing puts us off our food. You know, we are faced a lot of time with adversity and seeing terrible things, and humour is a coping mechanism for a lot of healthcare professionals. So I see humour used more in those types of communications and relationships rather than particularly from any external organisations that might be trying to advertise to us as healthcare professionals.
That's interesting that you bring up the sort of concept of the staff room, because Sarah, you're a doctor. So between the two of you, do you feel that there's a difference in the type of humour that, Emma, you would use as a nurse with a patient and perhaps you would use as a doctor because of your different roles in relationship to the patient?
It's a good question. I think doctors and nurses in general, there can be a difference. But my experience in kind of obstetrics, worked with midwives a lot. And, I think a lot of the time in obstetrics, when the doctor comes in, things are going wrong. Whereas the midwife has built this rapport with a woman who's been labouring for however many hours. And then the doctor might come in and they need to maybe act really, really quickly to get the baby out or to stop bleeding. So I think it helps build connections and relationships. And I think that sometimes when things are going wrong for a patient, all they want to do is have someone to come in and sort that out quickly without really building that connection straight away. But sexual health clinics, very similar to what you were saying, Emma, around smear tests and things, and actually allowing that patient to relax when they're in, legs apart, up, it's really not a relaxing environment to be in, but kind of getting a bit of a laugh, allowing them to relax, releasing, some nice hormones when they're laughing, just for them to physically relax and you to carry out the examination a bit better. But I don't know what you think, Emma, around kind of the doctor versus nurse relationship.
My experience as a nurse and a patient, I do tend to find a lot of the doctors a bit stiffer than nurses. I had one, so I'm type 1 diabetic, and I had one consultant that I was petrified of. He was, very tall and very serious, and I used to think, oh, he's going to bollock me and shout at me and, tell me oh, you've been eating chocolate. And I used to dread it. And I used humour as a coping strategy as a patient. And I just felt it always fell on deaf ear. And it was kind of let's focus on the serious thing. And I just think it really does depend on the interaction, the environment, the individual as to when humour is used. And like you say, Sarah, doctors tend to be the bearers of bad news. So, or the time pressures on them. We've all got time pressures as clinicians, but, you might go into surgery, for example, and you might not really see the surgeon, you might see him for 2 minutes. So all your cares are based around, and trust is based around the interaction with the nurses. So you've got to build that level of trust up for the whole team rather than just yourself as well.
That's a very interesting point. There's a lot of pressure actually on the nurse because it's your job to frontline, as you say, build that trust so that when the doctor has to come in and has very little time to communicate or build rapport, that trust is therefore transferred from your relationship.
Yeah, totally. And it's just a team effort really. But yeah, I think that the nurses, midwives, all health professionals really have a role in that. And it is definitely a team effort. And I think it's very much dependent on the person and the patient as to how humour hits and what people want. Because I think sometimes, depending on the situation, humour doesn't really work in healthcare settings.
I've the only complaint I've had in a 20 plus career I still find it hilarious, which I shouldn't really. I got called into the to the manager's office, and he said a complaint's come in, and I was mortified, and I was like, oh no, like what's happened? And he said, oh, you know, when you were doing the children's flu clinic, and I said, yeah, and he said, oh, some parents made a complaint, and I was like, oh no. And what happened was this little boy was picking his brain, and I said, oh, don't put your finger up there, it'll get stuck. Which I thought was funny to a 3-year-old, 4-year-old. And anyway, I had a complaint made against me from the parent.
Sorry, he was picking his brain?
Yeah,
he was picking
his nose. So his finger was that far up his nose.
Understood. Right. Okay. I wasn't sure where he'd stuck his finger.
Yes, not in his ear, up his nose. Yeah. And
although that's how the Egyptians did it. So,
but yeah, so I'd had a complaint from the parent, who obviously didn't find my humour very humorous at the time. So I was kind of like, okay then.
How did the patient take it at the time? Because you would have obviously said that to the boy. He would have laughed, taken his finger out.
He did take it out. Yes. Luckily it went in his pocket and not his mouth.
Oh, children.
But you know, so that's just an example of how sometimes humour falls on deaf ears.
But I think what's interesting in that situation, as often happens with humour, is that it wasn't the recipient who was upset about it. It was actually a bystander. Not to minimize the role that parents play, you know, in raising their children, but that we do see that actually in comedy. We'll see that a joke was directed in a particular direction, and it wasn't the person themselves that was unhappy with it. It was those around them. And when it comes to health, is that it might be that the patient themselves gives consent for the joke, but it might be their family or friends that say this isn't appropriate right now.
Yes.
There's a gravity to the situation.
So easy to be offended these days, isn't it? When it doesn't really, it's not about you.
On someone else's behalf. Yeah. The story that you told, Emma, about your humour falling on deaf ears when you saw a consultant. Now, presumably, and I think you said that you were using humour as a sort of a mechanism, a coping mechanism. How did it then make you feel? Was it like the opposite effect? That he just ignored it?
This is a thing, there's so much complexity, isn't there, in the patient healthcare professional relationship, and that it's so dependent on the individual. You know, I would class myself as quite a resilient person from, you know, my background, and I got diabetes when I was 11, so, you know, I had to learn the multitude of things that came with that. So I've probably always used humour as a coping mechanism, and the fact that it fell on deaf ears, that's just an experience, and I probably might have tweaked how I joked about it going forward in future consultations. And, you know, he probably knew what I was doing. I was kind of avoiding the seriousness of what he was saying. And I think at one point I probably burst into tears, actually, because, you know, as patients, especially with long-term conditions and chronic diseases, we know what we should be doing, but the reality, you know, the medical book of the old school medicine of what you should and shouldn't be doing, when we've gone to this kind of patient-centered approach. And at the time, I was probably around 21 at the time, you know, I did burst into tears because it's hard. And he was, this scary consultant was empathetic. He was caring, and actually that changed my perception on him. He still didn't laugh at my jokes, but I seen a different side to him, and actually we built a really good relationship from that. So yeah, he probably was like, you know, enough with the fun and games type thing. This is serious, but it resulted in a positive outcome in the long run.
I'm not sure that's the takeaway message we want from the episode. Make them cry, and then no. But what's interesting is that you find that you've had through your career a very successful relationship with humor and using that to build trust. But that actually, in that one situation, perhaps your relationship with him was undermined by a lack of humor.
Yeah.
And but through another emotion, that relationship was built.
Yeah, it's interesting that it took for me to emotionally break down for him then to react rather than kind of change his way. And I think, you know, I'm not saying, again, it comes down to the individual thing, but that's where other skills like emotional intelligence and self-awareness as a healthcare professional come into acceptable boundaries and being able to think on the spot of what is good for that person or not, that patient or not.
I mean, I assume it comes under sort of bedside manner lessons that they do teach, don't they, in medical school? They're starting to teach.
Yeah, I studied at Newcastle and they're renowned for being really good at ideas, concerns, expectations of patients.
Well, expanding that out then to how humor helps build trust. Sarah, you head up an amazing brand designed to encourage sexual wellness. What role does trust therefore play in realizing your mission and objectives as an organization? Because you use a lot of it, don't you?
Yeah, we do. And I think, we talk about sex, female pleasure, lots of kind of taboo topics, libido, but also things that people don't necessarily want to talk about. So kind of women's health issues that are less well known, but common. For example, we worked on a campaign with Leith called Let's Open Up about vaginismus, which is a common condition, but kind of culturally and medically not very well recognised or spoken about. And so we used humour in that really quite a lot in a kind of warm, playful, engaging way to open up that conversation. And we do lots of other similar campaigns that just use humour to open conversations. And I think one of our key USPs as a brand is our tone of voice, our relatability. We are real, relatable, and we don't gloss over the realities of being a woman and these intimate health issues. So I think, it really resonates with our community, and we don't get it right all the time, but I think humour is a really good way to tackle these taboos and stigmas.
Whose idea was it to use humor? Was that something that you, from the beginning, went, I want humor associated with the voice, as you say, of HANX, or is that something that you had to be convinced of?
No, it has evolved, and it's ever evolving. It's still changing. But I co-founded the company with my friend Farah. We went to school together. Come from very different backgrounds. She was in finance. I was obviously in medicine. We felt there was no other brand out there speaking in this kind of way that was open and engaging, and using humour, because sex can be a bit awkward, and people get a bit shy about talking about it, especially here in the UK. And I think we wanted to be relatable, and I think having an element of humour was really important. However, at the beginning, it was quite tricky to be a new brand selling medical devices, condoms, lubricants. People needed to trust us, so we had to really build that trust. So I think we were a bit, we shied away from it a little bit at the beginning, because we thought, we can't just make a joke of everything because they won't take us seriously. But it has evolved, and we felt that the kind of, things we do across, all our social, our emails, our website copy, everything is so much more relatable and well received when we use humour. But we are starting to go into kind of other areas of kind of women's health, including fertility and menopause, and actually some things humour probably won't sit quite right with, infertility and people who are struggling to get pregnant. That's a very difficult one.
That's really interesting because actually, as soon as you said it, when you first said there's some places where it hasn't worked, I wanted to ask what were those areas, but then you mentioned infertility and I immediately went, there, I bet that's tricky. Because I think we all feel it. I mean, as women on the panel, you go, I can see why that wouldn't be. Continuing on with that, and I know, Vic, you've obviously worked together on campaigns. Why use humor in this regard?
I mean, I think it does allow people to relate to what you're talking about, and it opens the conversation in a sense that, these are topics that are only whispered about or people don't talk about at all, and then, we're totally smashing the stigmas by speaking up.
Mm-hmm. I think it's the same. It's a similar emotion and a similar response as to your story, Emma, about when you were doing smears and you would talk about their socks. And that is the icebreaker, isn't it? And I think you've said it really well. It's all about opening a conversation. And the best way to open a conversation is to try and relate to somebody. And that's always going to be better if it's in a more emotional way, even better if you can make them smile.
So do you feel that builds trust, or there has to be a certain amount of trust to begin with, but then you use it to continue to build trust with your client base? Definitely.
And I think, we'd never talk about something without collaborating and working with people who've had lived experience in that, because we're not going to say this is how someone's going to feel with this condition, for example. So we make sure we do have those voices.
Well, let's open that up. So we had the Let's Open Up campaign, which was advertising vaginismus, which I remember first reading about in foxes, which I know is not the place to find out about it, but don't foxes, yeah, anyway, sorry, going off topic. But they do. That's why they scream after they have sex, because they don't let go for like 3 days.
I'm like, oh, tell me more.
Yeah, well, I mean, I suppose we should explain it. I think there's going to be a lot of people listening to this that don't even know what vaginismus is.
Basically, it's when the vagina involuntary response, it doesn't allow anything to go inside. So anything, even tampons, sometimes people can't insert because there's this involuntary reaction.
Which is a contraction of the muscle. Right. Which, sorry, just to finish that, Emma, foxes do it after they've had sex. And it's just a way of sort of ensuring that conception happens by kind of keeping them in there.
Nature's way of ensuring.
Nature's way. But then even though it happens naturally, they still scream all the way down the neighborhood at 4 a.m. So opening that. So we've had this campaign together with HANX and Leith working together on it. Tell me a little bit more, Vic, about you've worked a lot with organizations aiming to improve health outcomes and change behavior. I suppose with the Let's Open Up, we were trying to raise awareness because you can't really change an involuntary behavior, but you can raise awareness about it.
Yeah, raise awareness and allow people to get help and support when they need it, or even just going to their doctor and talking about it, which a lot of people don't.
Which is a changed behavior then.
Yeah, exactly. So that's the behavior we wanted to change, was to break down the taboos and get people talking about it, which is, again, why humour is a good way of doing that. And it was a powerful and beautiful campaign, but it wasn't like rolling on the ground laughter. It was just bringing levity to it and just having a really good tone. I think, again, your point about lived experiences is absolutely fundamental here in that people advocating for something that they have experienced, that is going to build trust, isn't it?
Then my question for you, Vic, is do you buy the correlation between trust and humour when it comes to advertising?
Yes, I do. I think it's difficult when you start to think about a brand trying to use humour. And I think that Sarah answered it better than I could really, was that you needed to establish yourself first. And that wasn't humour from the offset. It was, here we are, here's the proof of our service, our products, testimonials, whatever, however you do it. Once you've gained the trust there, then you can begin to use humour, I think. It's like a complete stranger trying to be the funniest person at the party. You're not going to accept that as much as you would if it was your best mate being a bit of a dick. You know, you'll be like, yeah, it's funny because he's just like that. If it's somebody completely different, you're like, who's this guy trying to make me laugh? So there's definitely a job to be done to establish trust before you can go straight in with humour. So I think, again, it's about really knowing your audience and really knowing what's going to be relevant to them and what's going to help them.
Well, that's really interesting. How do you do that as a brand? Because, of course, as a brand, you want to raise awareness. At what point do you know that you've established the trust to be able to then use humour to be able to then change behaviour?
I think it's a time thing, and it's also a growth in your community thing. So I think now that we can access our audiences so much quicker as brands and understand the psyche of your community and how they feel, and you can talk directly to them through social media, and you can gain that vital feedback really quickly. Whereas in the past, I think you would have to go and do like 20 focus groups to really understand whether something had landed or not landed. I think we get feedback in this sort of feedback loop a lot quicker now. And you can also test things a lot better now. And you can go out there, just like anybody on social media can go out and say, okay, that one didn't land. Let's, learn from that.
I can relate to that as someone who puts jokes out on social media.
Yeah.
Oh, that one didn't land. And it's let me know in the comments.
Yeah. I think don't take yourself too seriously as a brand as well, because, okay, I mean, so many brands do it now, saying, right, we got that wrong. That sort of thing. Having an element of humanity around the brand is going to help build trust as well, and showing that you also have failures and you can learn from them. I think that I feel like you're probably more qualified than I am to answer that question, but it feels to me like you just need to build a relationship with the people that you're speaking to.
That's interesting. So how does that relate to reputational campaigns? You know, for example, a lot of pharmaceutical companies face challenges with trust, particularly when it comes to topics like immunization, innovation. Do you think that humor can help increase trust and confidence in topics like vaccines, equity?
I think that's a trickier one because when you think about those campaigns, I feel like you've got to think about the cultural sensitivities. So I think about pharma companies and I think about big health campaigns. They're often global, or they're often speaking to a really varied audience. You're talking to parents, you're talking to older people, you're talking to kids.
I think companies can benefit though by not just doing a big campaign and by breaking it down into subsectors, because they'll probably find that if it comes to vaccination, there is a greater uptake in a certain age demographic or a certain background of person that would uptake on the vaccines. So therefore, by having subsectors of campaigns and targeting specific audiences and using humour in the more difficult to engage with people, I think that can bring more success rather than doing a one-size-fits-all
Exactly, and I think that's always going to be a difficult thing to do. I also think we're talking about brands not taking themselves too seriously. There are some industries that just fundamentally do take themselves too seriously, and it's trying to break that down a little bit.
But to wrap up on that sort of thinking, if we think about the comms journey that someone goes through when it comes to diagnosis of disease, is there a specific moment or channel that's best suited for building trust and using humor? Is there a point where we go, it's better here? Sort of like when you say, leave your socks on.
I think if we're looking at a patient's journey, then prevention is obviously best. You know, a lot of modern diseases are impacted by our lifestyle and consumerism these days. So the more that we can do to prevent conditions from happening, the better. And I think humour is the best way to do that. And then obviously we can stop the worsening of conditions by people then taking the advice on board. And I think humour for the right individual is the best way to do that and engage them. I think there's some science behind that. When we find something funny, we release some hormones, and then we can recollect that information far better than data or facts in our memories. So for example, I'll go into, the workplace, and I'll have grown-ass adults singing nursery rhymes. And I'll relate characters like Humpty Dumpty to musculoskeletal problems. And the next time that person, hears that song with their own children, their grandchildren, etc., they're like, oh, my posture. And it's just about trying to use humour or something that's a bit different to engage people in making small changes. But I think the later stages we go in people's health journey, the more we get to end of life, terminal prognosis, I think, we can still have compassion and empathy and have joy with people, but that humour has to change.
And you follow their lead, or is that who leads that change?
Well, I think by that stage you've probably built a relationship up, and that becomes a different type of relationship. So if I think back to, I've worked in district nursing in the past, and we will have end-of-life patients at home, and you almost become a part of the family when you're in that person's home, and banter and what you would do with people. But there's a time and a place for everything, but it's built on, you've already developed the trust, but it's using it in the most appropriate places. But there can be happiness and joy found in sad situations. It doesn't all have to be doom and gloom. It's about using it in a way that supports people and it brings them comfort at a time when they might be struggling.
It's interesting, isn't it? Because I would agree completely. It's pre-diagnosis is the best, is the easiest place, and the place where you will see a lot of humour in communications and advertising. Whereas all the occasions that you were talking about there, Emma, I feel like there's no space, and unless what that communication, is trying to do will help in any way. So when it comes to end of life, you feel like what's the point of a brand or an institute or an organisation coming in at that point?
You say that, but I mean, going back to my gallows humour, you know, end of life, for example, there's lots of talk at the minute around assisted dying and bringing that in. And I suppose when we're talking about marketing and communication and brand awareness, we have to go back to what is the purpose of that brand. And, you know, lots of people die and they've not sorted their wills out, or, you know, sorted out what happens after they've gone, or talking about funerals. And perhaps there could be humour used in those situations. But I don't know if anyone's brave enough to attempt it.
Well, I think that some funeral directors do very, very well. There's a funeral director in Edinburgh called Go As You Please. Don't know if you're familiar with it, but they make coffins like you get an Iron Brew can or a Tennent's can or like a bottle of whiskey. Your coffin is that. I've not seen them advertised, but I bet if they had the budgets, they would enter the conversation at that point. So you're absolutely right. And I guess I was thinking in terms of what is this brand going to sell you that's going to help you at this point? That's exactly right. It is going to be like, how do I want to go? And I think it's a really interesting point about assisted dying. I think that is so much conversation about it. And I'd be so interested to see how companies, given that there's only one that we really know about at the moment, start to talk about that.
And I think it comes back to that building trust and then perhaps integrating some sense of humour within that. But yeah, it's an interesting space. That's for sure.
And I think for us, you know, we use humour a lot to tackle the hurdles that kind of impede people advocating for themselves. So I guess it's going back to the space of, you know, prevention and actually giving them the tools to be able to communicate or to understand these conditions to then advocate for themselves. I think that's how humour can work really well.
So just to summarize, what we talked about a lot here, actually, but we're talking about the concept of trust and where humor can help with that. And I think we've all agreed that there needs to be an element of trust for humor to even happen. And we've seen examples of where there is not that permission or there wasn't that relationship to allow it to grow. But that, especially when it comes to a patient's relationship with their HCPs, the nurse is the front line, but it's a team effort, that the trust that's built and the humor that comes through that helps the entire team serve that patient and work together for best outcomes. And then expanding that out into brand marketing and advertising. I think we've agreed that there needs to be an element of trust for the brand before humor can be introduced and used thereafter. And then we spoke very interestingly about situations where companies, for example, pharmaceuticals, might not be able to use humor because they're working on a deficit of trust, or they're working, you know, in an area where there's a lack of understanding or even a negative emotion towards it. And so therefore humor's inappropriate at that point to bring into it. So you have to almost start at either a fresh start and build the trust, or get your trust back up to zero before you then build on trust to then be able to use humor. But we've all agreed that the best place to use humor, where there seems to be the most trust or the most consent for it, is actually in a preventative space. And so that there's a lot of opportunities for advertisers and brands, especially when that is their marketing or that is their area, is to use humor at that point to grab people before it becomes more emotionally complex, such as at diagnosis or even at end of life, although we've all conceded there can be some humor at end of life as well. Thanks again for joining me on A Healthy Dose of Humor. And remember, if you're interested in hearing more about the topic of health and humor, or connecting with any of our series contributors, you can access all of that and more at leith.co.uk/healthydose.